As the Delta variant continues to run rampant in the natural state, concerns over the state's ICU capacity are growing. Right now, that number is comparable to how low it was during the first surge of COVID-19. THV 11's Ian Russell is live outside UAMS, where they're currently struggling with ICU bed capacity, and they're not alone. Ian.
Yeah, Marlisa, they are most definitely not alone. The Arkansas Department of Health told me today the situation is so bad that any hospital in any corner of the state is seeing the exact same thing. Too many patients and just not enough beds to put them in.
It's been a roller coaster.
For ICU nurses like Elizabeth Sullivan of UAMS.
And actually, we're a little bit over capacity in ICU beds. We're actually making ICU beds out of units that are not meant to be care for ICU patients.
It feels like the progress they've made has vanished.
And now it's just back down. People are so just devastated, working 40+ hours extra a week.
Nurses like Sullivan were offered some relief when cases started to drop earlier this year, but now the spreading Delta variant has shut the door, and hope of them getting some help is dwindling fast.
There's no relaxation, there's no relief.
The problem we're running into now is that all of the hospitals seem to be at capacity and not able to do much flexing at all.
Dr. Geraldine Jones is the medical director for preparedness at the Arkansas Department of Health. She says this isn't an issue just here locally.
The fact that statewide there are so few ICU beds, it is very, that is a dismal situation and very concerning.
There's a total of just under 1,200 ICU beds statewide. As of Thursday afternoon, the number available, just 36.
It's absolutely depressing, again, because it is so preventable. Get your vaccine, wear your mask, social distance. All of these things are how we're going to fight this and beat this.
But that won't be easy. There's two groups of people fighting for one bed.
We're not set up to house these patients that require 1-to-1 level of care or 2-to-1 level of care for extended periods of time. We're just not set up that way.
You know, you think about, if I have a heart attack or if I have a stroke, I need to go to the hospital. We don't have anywhere to put you. It's that serious.
Sullivan says this will stay a serious issue unless things change, and soon.
There will become a time when, kind of like in the middle of battle, you have to triage patients and decide who can I take care of. If things don't change in the next 3 months or less, we will be there.
Now, that nurse Elizabeth told me that burnout for those nurses everywhere is very real. She said it's so hard to ask nurses to come back and work, sometimes triple their workload after an already busy week. Now, Dr. Jones told me she's even heard stories of some nurses who have quit the industry entirely because of how bad the situation has gotten. Reporting live at UAMS, I'm Ian Russell, THV 11 News.